Well, we're back with another edition of MITechNews.TV. I'm Matt Roush. My partner here is Mike Brennan, a longtime technology journalist here in Michigan and before that in other places. We have with us as a guest today the Provost and Chief Academic Officer at Lawrence Technological University, Richard Heist, who's going to tell us a little bit about the latest and greatest at the new LTU College of Health Sciences. Dr. Heist, welcome to the program.
Well, Matt, Mike, it's nice to see you guys again. It's always a pleasure to be back here sharing some time with you all. I do appreciate it, and there's nothing more I like better than spreading the gospel about the university. And we have a lot of verses to talk about in our gospel, to use a little analogy here. Now, you mentioned about you were interested in the College of Health Sciences. Well, it's our newest college. We stood this college up in July of this past year. And the latest and greatest piece of information is that we now have hired a founding dean for that college. You probably know that when we don't have a dean of a college, the provost gets to be the interim dean. And so all of a sudden I'm the provost and the interim. And I've not done much in the health science area in my career. So it's been a great learning process for me, and also very exciting to help guide this college, given my outside looking in view at the future of the health science college. So this is a very innovative plan for the institution. The new dean, Dr. Mary Schutten, comes to us from Central Michigan, where she was dean and provost over there for a number of years and had done a wonderful job with those folks over there in Lansing. But she's going to start later this semester. I'm so happy to have her here. And we've already been Zooming, and she's been Zooming with our program directors, and she'll be a great addition to not only LTU, but certainly to that college, and will definitely take it in the direction with the trajectory that the president wants this university to go. So first of all, that's the latest and greatest with respect to the college.
So can you tell me a little bit about her background? You said she was at Central Michigan before, in Mount Pleasant?
Yeah, she was a professor of kinesiology, but she also served as dean in the health sciences. She was a provost for a number of years over there, and she's done research in her area of kinesiology, and has actually a very impressive background. But what I like is the fact that when I shared with her our plans and where we see this college going and where we'd like to have it go, she bought into it right away. And I was so pleased to have someone on board who understood, who gets it right from the beginning. We want to grow enrollment. We want to grow programs. We want to be able to support the Michigan healthcare industry that we're such a part of here in the state, particularly the southeastern portion of the state. And she understands the importance of research as we move along that trajectory as well.
What's current in terms of programs at the college, and what can interested folks expect to see going forward?
Okay, that's good. There's a couple parts here. First of all, the institution, this is before I was privileged to become part of Lawrence Tech. This institution started down this road back in 2017, and they built a nursing program in 2019, a physician assistant program, and then in 2022, a cardiovascular perfusion program. This is all before they had a formal College of Health Sciences. So what that meant is they had an on-ramp where they could build and grow. And when they announced the college, they had 3 fully operational, fully subscribed programs already on the books with this college, and one additional program which is going to be starting in the fall. So this college is off to a great start. So that's what you would see if you go to our website, and if you go look at the College of Health Sciences, that's exactly what you're going to see. Now, what's coming? Because that's kind of the exciting thing here, is what we can do to build on this, on the early successes of the programs that we already have. One of the things we want to do is we want to help support the healthcare industry in the state. So one of the things that we're looking at is to say, where are there shortages? And we partner with Ascension, with Corewell, Henry Ford, a number of these organizations. And what we discover, for example, is there's a tremendous shortage in surgical technicians, for example. All right. Well, we can fix that. And what we're doing to fix that is that we've created a very interesting little model where I call it the hub and spoke model. In fact, the Provost office actually came up with this idea where the hub, the center, the core would be the courses that are pretty much common among a number of different disciplines, a number of different spokes. Surgical tech is one, respiratory therapist is another, dental therapist is another. So you see a radiological therapist. So there are a series of spokes with a very similar, not identical, but very similar core. So we start that hub and then we build out the spokes. And what's happening right now, when the reason we chose surgical tech was because we know it just one of those organizations I mentioned earlier, there's a shortage of about 125 surgical techs right off the bat. Mm-hmm. So we have under development right now, it's being written as I speak with you, a proposal for the creation of this surgical tech spoke that goes along with the hub that we've already created, the general hub, anatomy, physiology, biology, the sorts of things that most of these hubs, most of these spokes will require. And by the time they finish, they'll have an associate's degree in surgical technology, and they will have been prepared to take the certification test that's required to get them into the operating room and begin to be part of that hierarchy of the surgical tech operations in the operating room. And one of the reasons I chose this hub and tech model, we chose to go forward with that, is because it dovetails really nicely with our dual enrollment programs. Now, you may have heard that we're very much invested in dual enrollment in our high schools. We have something like 60 plus high schools where we have dual enrollment programs. This has all happened before I came up, but I'm so impressed with what the folks here at Lawrence Tech have done to build this framework. Now, just think about this for a minute. If these young men and women in the high schools, when you talk to them about a medical career, the first thing they think, and we know because I asked them, the first thing they think of is doctors and nurses, which
Sure.
is perfectly reasonable. But the thing of it is the horizon that's associated with becoming one or the other of those two examples is very far down the road. And it's hard for these sophomores and juniors in high school and seniors to look at that and think, my goodness, I can't, that's a long time. So now you go to the associate's program with this hub and spoke model, and it's 2 years. And they take 3 to 4 of those courses, those core courses already in college or in the high schools, and the high schools are paying for them. So you get this tremendous tuition savings, you get a time savings. So in the space of about 2 years, you have an associate's degree in one of those spokes, like surgical tech. You're certified to go, and you're ready to go actually earn a very decent living wage with a career path. Or you're prepared to jump to that next level and look for a bachelor's degree, for example, in one of those similar topics. So this structure that we're building out to help pump these young people into these professions is truly exciting, and it's very innovative actually to make that connection that we're doing. And so not only with that end, the high school, the associate's degree, but we're also looking at the other end, and we're putting and this came with Mary's advice, Mary Schutten's advice. We're in the process, it is being written as I speak also, a proposal for the creation of a master's in occupational therapy that's going to be connected to a doctor's of occupational therapy. Her advice to me was, listen, the trend is to the doctoral level. It started with the diploma programs and the nurses, then the push was to bachelor's, then the push was to the master's with the nurse practitioner, then the push now is to the doctoral level. And you're seeing it in every one of these disciplines. So we're actually creating now not only a master's in occupational therapy, but also a doctorate in occupational therapy as well. And finally, the last one or two master's programs. There's a master's that will launch in September. It has been created. Master's in healthcare administration for those people who are interested in more of the administrative opportunities associated with our vast healthcare network here particularly in Michigan, as well as our MBA. We have an MBA program with a healthcare focus. So it's exploding right now. The things that are happening within the next 2 years, you're not going to recognize this College of Health Sciences. No kidding. That's what's so much fun about this whole thing. And I've been able to do this even though I'm not heavily invested in healthcare myself, but we have lots of good input. And when Mary came and joined us, or Dr. Schutten came and joined us, she added validation. So we actually were making reasonably good decisions that help us move along the trajectory that President Soap has laid out for this university.
Well, I notice also that I think probably a lot of these programs are going to be fairly interdisciplinary in nature, which is another priority of Dr. Soap, I know. Um, the uh, the healthcare administration program would, I'd imagine, draw heavily from the College of Business and Information Technology. And I know some of the other healthcare programs we've got are sufficiently technical that they're drawing a great deal from the College of Engineering, right?
You're spot on, Matt. Absolutely. We have an affiliate program in that I mentioned earlier, the cardiovascular perfusion, a really highly technical healthcare program, but it's embedded in engineering because it's so technical. And this healthcare administration program and the MBA with the healthcare focus is coming over from the College of Business and Information Technology. I keep talking to people about becoming more horizontal and less vertical. We get away from the silos. There's strength in diversity. There's strength in inclusion and collaboration. And that's what we're pushing very, very hard. Arts and sciences heavily invested already with nursing in terms of instruction and basic research. And one of the other things that we're doing, which will really be neat when these things actually become operational, we're embedding virtual reality and augmented reality methodologies to enhance instruction in the College of Health. We're starting there, the College of Health Sciences. Folks from the cognitive psychology program in arts and science, as well as our partners with the cardiovascular perfusion program that Comprehensive Care Solutions are working together to create some of these high fidelity virtual environments. Just imagine holding a heart in your hand, and being able to, or you have a cadaver in front of you and you're able to explore the position of the organs without actually having a cadaver sitting in front of you. But you have this high fidelity virtual environment. My overarching goal is to create the holodeck. Now you're old enough to remember Star Trek.
Sure.
And the holodeck where you win and create all these interesting, all of a sudden you're immersed in a virtual world, which is realistic. That's what we want to do here. And we're actually making some progress toward that goal.
The last thing I wanted to discuss with you, if we could, is that LTU is, becoming more and more of a research-focused institution. How's this starting to play out in the College of Health Sciences?
It is. The reason it's starting to play out because we have in particular, our nurses, where most of the research at the moment happens to be in the School of Nursing, because there we have PhDs and we have professional nursing folks, faculty, who have actually done research for their thesis, for their PhD thesis, or for their doctoral projects that they have to do. We have folks working on forensic science, for example, the role of medicine in helping with forensic science, and also looking at relationship-based care, looking at how violence impacts on folks that are living together, right? Folks that are close together in real life, and all sorts of interesting things, which are kind of different than what I'm used to, if you get my drift, being a scientist and an engineer. So it's fun to look and see what these people are doing. But right now, the focus is largely on enrollment growth, not quite so much on research at the moment, although we're doing it. But 3 or 4 years down the road, as these programs really come to fruition, there will be a much stronger, and Mary Schutten will make this happen, a much stronger growth on all kinds of interesting research applications into college. Very exciting times, Matt.
All right, so can you highlight a couple maybe of those faculty research projects that are going on? You touched on them very briefly a moment ago. I wanted to know if you wanted to explore them just a bit more while we wrap up here.
Well, I particularly like the one with forensic science, where they're using healthcare and medical technologies to understand the nature of crime. Right? You hear about on TV. You watch these shows, where they apply all these interesting technologies to solving crimes. Well, there is a very real forensic science application involving the healthcare industry, and that's one of the areas that our folks are exploring right now.
All right. Well, thanks very much for being with us today, Dr. Richard Heist, Provost and Chief Academic Officer at Lawrence Technological University. The website to learn more about all of these things is ltu.edu, and there you will find information on all 5 of LTU's colleges, the newest of which is the College of Health Sciences with a bunch of exciting new programs.